Welcome to the deep dive. Today we're digging into something pretty significant, the nationwide implementation of AI in cardiovascular care.
It's definitely a hot topic.
Yeah, and I know many listeners are interested in this space, especially responsible AI screening for heart disease, maybe even things like blockchain's role.
Right, that's come up before.
So this Nature Medicine report on national AI programs feels like a perfect fit. Our mission really is just to unpack what these national programs involve and, well, why they matter so much.
Absolutely. And the core idea, I think, is this shift towards embedding AI right into national healthcare systems to tackle cardiovascular disease.
Okay.
It's not just, a few hospitals trying out new tech.
Yeah.
This is planned,
Yeah.
coordinated, a whole country approach.
hmm
And it definitely builds on some of those privacy-focused AI ideas people might be hearing about.
So when you say national implementation, what does that actually look like on the ground? Is it some huge central AI running the show or something different?
Hmm. Not quite a single central brain. It's more about creating a national framework.
A framework.
Yeah, so that proven AI tools can actually be integrated systematically
Oh.
across the whole healthcare system. Think standardization, shared platforms, perhaps.
Okay, so it connects back to things like those AI screening chatbots you mentioned earlier, the ones highlighted in that Nature paper showing how AI can engage directly.
Exactly. That research gives us a peek at what AI can do at the individual level, right?
Right.
National programs are about scaling that, taking those kinds of benefits and ideally making them available to everyone in the population.
Got it. So taking successful tools and deploying them widely, but within a structured system.
Precisely. And the fact that this is being documented in a journal like Nature Medicine,
Hmm.
well, that adds a lot of weight, doesn't it? It shows this is serious, credible work.
Definitely lends credibility.
Yeah.
Okay, so let's cut to the chase a bit. What are the practical benefits? If AI is implemented nationally for heart care, what changes? What's the so what?
Well, the big advantage is data on a massive scale. Think about it. A national approach means you can analyze huge amounts of anonymized health data, way more than any single hospital or even region could manage.
Oh, okay.
So imagine AI combing through that national data, spotting really subtle patterns, maybe early warning signs for heart disease that we currently miss.
Ah, I see. Finding those needles in a nationwide haystack.
Exactly, leading to much earlier, more proactive interventions. Not just for a few people, but potentially for millions. It could fundamentally shift population health outcomes for cardiovascular disease.
So it's about that scale then. Leveraging AI's pattern finding ability across the whole country for earlier detection. That sounds potentially life-saving on a huge scale.
It really is. And think about the efficiency gains, too. Plus, the potential for tailoring a preventative care much more precisely based on these massive analyses. The public health implications are, well, pretty substantial.
Okay, so pulling this together, these national AI programs for cardiovascular care, they represent a major leap, don't they?
I'd say so.
It's like taking the promise of AI we've seen in specific tools or research and really applying it system-wide, aiming to boost heart health for entire populations. Sounds like a genuine game changer.
That's a good way to put it, yeah. It's definitely an evolution in how we think about managing and preventing heart disease, a big one.
So let me leave our listeners with a final thought. Considering this potential of national AI programs, plus all the ongoing work in AI screening, data analysis, privacy, what future possibilities do you see opening up? How might technology really reshape preventative care and well-being across the country down the line? Definitely gives you something to think about. Thanks for exploring this with us today.